Today I want to talk about experiencing pain at the dentist's office. In particular, for my patients who are over 60, maybe even over 70, an interesting thing happens, which is that as we age, we get more sensitive to pain, but we also get more sensitive to medication. So our body isn't able to process as quickly any medication, whether it be injected or oral or whatever. And so what I experience sometimes is my elderly patients are more nervous. Maybe they had trauma in their past. Maybe they came in already in pain. And then what we want to do a lot of times is take some extra steps to make sure that the tooth in the area we're working on is completely numb. And we do have a system for doing that before we get out the drill, which is really important. But what I find is it's very, very important in my retired patients for there to be excellent communication between myself and the patient, so the patient knows that it is okay to stop me and to say, hey, I have a concern or I'm feeling that. And it's very, very important and extremely effective for me to always respond. If someone makes a noise, even if they just shift a little bit, I'm checking on them. And of course, if they say, I'm feeling that, I would never, ever, ever say, that's impossible. And I would never say, well, I'm almost done. Can you just hold on? No, I'm never in so much of a hurry that I need to drill on a tooth when someone can feel it. And you just want to find someone like that in your area. Someone who respects the fact that the pain gets more unpleasant as you age, and also who takes the time to make sure that you're not feeling pain because it's not necessary. Thanks, everybody. Okay, today we're going to be talking about old mercury fillings and cracks. So what's really interesting is this old filling material that we used to use a lot in dentistry, which is referred to as amalgam. It was actually over half mercury, but that's for another day. But these mercury amalgam fillings are very strong, very durable. And what we find is that the way they were placed, the way that we would have to shape the inside of the tooth in order to get the mercury amalgam to stay in the tooth, because they weren't bonded, not traditionally anyway. They would stay in from mechanical forces, but that making of an upside down V to get or a triangle, to get that amalgam to stay, creates a tooth that is more susceptible to cracks. And when I say crack, I mean like the crack through the windshield of a car where there's a hairline separation of the enamel from itself. And this can create a lot of problems, and cracks can be very unpredictable as far as, are they going to be a problem for me? Because I can look at a tooth that has a crack in it for decades and not have any problems. But sometimes the crack will extend onto the root of the tooth. It's just sort of like, if those who live in winter climates, when you start a car in the cold and it starts to warm up quickly, the windshield will sometimes, that crack in the windshield of a car will all of a sudden just creep across the windshield in one day. And that can happen to our teeth if we haven't treated the crack. And if a crack reaches into the gums of the tooth, then all of a sudden that crack becomes kind of like a super highway for bacteria, and it can really start to hurt. In fact, I have 2 personal friends who have ended up in the emergency room because of a cracked molar. And so what we like to do is try to secure that tooth before the crack extends onto the root. And it's not a guarantee, unfortunately. Even a secured cracked molar might still extend onto the root of the tooth. But if we've kind of like hugged it up or wrapped it, then it's less likely to have that happen. And there's two different ways to do that. The first and original way is to put a crown on the tooth, which kind of hugs it using porcelain or gold. Wrap it up, and those segments of the tooth that are separated by the crack are then kind of shoved back together. And then in my practice, we've gotten away from using crowns for cracks. I still use crowns when I have to, but we do something that's a little less invasive called an overlay. An overlay uses resin instead, which I can do with injection molding instead of trying to make space for the porcelain or the gold by shaving down the sides and the top of a tooth. With a resin and injection molding, I'm injecting right into the tooth, and so I don't have to create that pathway, which means that I can secure a tooth with a lot less drilling, and that actually makes the tooth less likely to need a root canal as well. So there's all the information you could ever want about cracks, and if you have questions about it, just leave them in the comments. Thanks. As we age, our teeth over time continue to accumulate deposits of color in them, and they can get looking dingy. And some of my patients don't like that. They want their teeth bright and white, keeps them looking healthy, and they can smile and be proud of their teeth. And so a lot of times my patients will tell me that they've been using a whitening toothpaste. And I just want to caution everybody, when it comes to whitening toothpaste, a lot of them are very high in a measure of how abrasive they are. Meaning the way that they're getting your teeth lighter is by scratching a little bit, scratching off the stain. And sometimes the scratch effect can actually make like the fillings and the crowns in your mouth more susceptible to stain, and they can also make your teeth more sensitive to touch and cold, especially in the areas where we have recession, meaning that the root of the tooth is exposed a little bit, where your gums aren't covering them up anymore. And so I just want to say there are really effective, cost-effective ways to whiten your teeth without using whitening toothpaste. And I would bring your whitening toothpaste to your dentist or your hygienist to say, is this a safe one to use? Otherwise, utilize the whitening that your dentist has available, or even just, Crest strips, which you can buy at a grocery store, that they all have basically the same active ingredient. But keep in mind that a Crest strip is kind of short. It'll basically go from one canine to another. So if you're like me and you're showing all these back teeth when you smile, you kind of want to use 2 Crest strips for one arch. So you put one here and you put one there. And another thing to keep in mind is that crowns and some fillings are not going to whiten at all. So if you have a dark tooth and then you whiten everything and you wonder why your crown looks dark, well, you might need a new crown now because to make it match the rest of them. So just keep that in mind about whitening. Thanks, everybody. Today, I want to talk to you about losing teeth. Unfortunately, that does happen over time. We can lose our teeth to gum disease, to cracks, to giant cavities, to failed root canals. It's always such a disappointment when we lose a tooth. And when we talk about replacing teeth, there are so many different options. It used to be that all you could do was get a bridge or a denture. And of course, the bridge has its problems, mainly that you have to sacrifice the neighbor teeth, put crowns on those teeth in order to replace the one missing tooth. But also a bridge can get a cavity underneath it where the bridge meets the tooth. And then of course, dentures is not anyone's favorite thing. They come in and out. They might flop. They might not blend in very well. They tend to hold food around the teeth. They actually cause cavities when they're hooked onto neighbor teeth. Not a full denture, that doesn't cause cavities, but the ones that hook onto neighbor teeth do. So along comes implants, which in the past probably 20, 25 years has really become the standard of care for a missing tooth. And what's really surprising, everyone's always surprised at how much one implant costs. In my area, an implant is going to cost you around $6,000 start to finish if it's replacing one tooth. Okay. And the reason that it costs so much is because there's a lot of different people who need to get paid in order for that one implant to get all the way put together, because you have the company that manufactured the implant, you have the lab who creates the crown that sits on the implant, you have the surgeon or the general dentist, depending on who you're seeing, who places the implant, and then you have the dentist who puts a tooth on the implant, which is two separate procedures. Placing it and putting a tooth on it are two separate, because they're like sort of like modular shelves. Implants are. So anyway, it's wonderful because they can't get a cavity and they don't usually break. I've seen a few break, but usually not. And they don't usually get gum disease, but they can. Usually if they survive the integration period at the beginning, then they are going to be fine. But that's implants. You cannot take a single tooth implant and convert it into an implant that's going to support a denture. For those, you need completely different implants that are placed in a different way. But like if you get an implant here and then you lose a tooth in the back, you can always connect those two with a bridge later on that's just supported only by implants. And that sometimes works for people who lose a second or a third tooth. But yeah, that's implants.